let's talk about those guidelines. 6 feet away, or if I'm a teacher, I'm 12 feet away presenting without a mask. What about these face coverings? Do they work? Should they go all the way down to 2? Pre-K kids, elementary kids. And that being said, when you talk about that, also talk about, if you don't mind, what should I do if I'm a child going home after a school day, if I have older mothers and fathers in my home and potentially grandparents? What should I do when I first get there? Do I take my clothes off, take a shower? I mean, what do I do? So
Yeah.
help me through some of those thoughts.
Right. So what I'm going to tell you is a combination of information that's been derived from actual studies and observations, and a lot of it just based on generalized information from other infections that we've studied over the last 100 years. And then the final piece of all that is people's opinions. It's very important that everybody understand that the information we have continues to change. People all over the world are studying this virus, and new information comes out every day. And some of the information we learn from unique situations that create information that allows us to know how this virus is transmitted. For example, in Washington State, there was a choir that got together, and they were roughly 3 to 6 feet apart. And one of the people who came to the choir practice was infected. And there was an extraordinarily high rate of infection in that choir. And from that single example, we learned that singing is likely to project virus particles much farther than it would if we were sitting quietly talking. Now, you can generalize about that, and you can talk about shouting, cheerleading, a lot of other type of activities where your exhalation is at a much higher volume and velocity than it would ordinarily be. And so in those situations, the 3 to 6 foot rule probably doesn't work so well. And there are going to be all kinds of examples where that occurs. This is a little bit of an appeal for a quieter, more milder approach that we take with each other. Less shouting and screaming and more quiet discussion is actually a healthy thing to do for multiple reasons. One, because you're less likely to transmit or contract disease, but also it's better for our, general health and immune systems. Dr. Cleveland, the issue is based on all this collective observation, we have come up with some recommendations. We have not studied these in the laboratory. We have not taken people and put them 6 feet apart, 3 feet apart, 12 feet apart, infected them with coronavirus, and looked to see how many people on the other side of the room got infected. We have not done that. When we usually do science, those are the type of experiments we do. In this case, it's all observational and experiential. And from that, we have estimated that being about 3 to 6 feet away, and the numbers keep changing. It was initially 3 feet. Now it's 6 feet away. Gives us a greater safety cushion in terms of transmitting disease. Now, again, being 6 feet away and screaming and shouting and singing won't do it. You're going to have to be 12 feet away. And you can't play a flute or piccolo if you're 6 feet away. You've got to back away to 12 feet away, because we've learned that the way that you blow air across a flute throws particles out into the room. So some of the guidelines that we put out about band practice and other things address some of those issues. The question you ask is about masks, and are masks effective? There's been quite a bit of talk about why the CDC didn't recommend masks earlier. And again, we're dealing with an unusual virus, and there was a lot of concern about whether masks were actually effective or not. There was some very early preliminary data out of Korea that said maybe they're not effective, maybe they're even more harmful, which slowed down the world's response with masking. In societies like the Asian societies, where they have preferentially used masks to prevent illness for years and years. They put them in right away, and we learned from places like Korea and Japan and Hong Kong that when those practices were put in place, the surge of cases came to a quick stop, plateaued, and began to drop off. So we've learned from these giant social experiments that yes, masks work very well. And there's been also some recent data in the United States that the southern states where masking has not been done early have had much higher rates and much more prolonged surges than states, particularly in the North and Midwest, where masking was done earlier, and they've seen more limited surges and spread. So there's really been a consensus developed. The director of the CDC 2 days ago made the comment or wrote a paper in the Journal of the American Medical Association say the time is now. We know that it works. We need to do mask mandates. And I want to say that the Springdale School District was the head of the curve on this because your board, I think, recognizing what the data was showing, voted to mandate masking in schools. And I completely support that, as does the AAP, CDC, and pretty much every other health organization in the world. I think that's going to be an effective way of limiting spread, even if cases come into the school. That's something we all have to recognize, that given the amount of disease that's currently prevalent in Arkansas, and particularly Northwest and Central Arkansas, there are going to be cases that show up in school. They're going to be children of parents who perhaps were silently infected or whatever, and we discover that a child is positive. But the goal of wearing masks, the goal of social distancing, the goal of all the other interventions we're going to talk about is to prevent further spread within the school system. And we've got an advantage over every other sort of indoor setting in that it's largely children that we're dealing with. So their ability to transmit is limited. If we do these simple maneuvers, for the most part, we're going to be very successful, I think, at preventing transmission within school districts. The guidelines that have come from the Department of Education have made the point that a single case doesn't mean you have to shut the class down or close the school, that we expect there will be single cases that come, maybe even a couple of cases. And we may close down a classroom if that happens. But we don't have to close down the school, because if everybody's doing these preventive measures, there shouldn't be any further spread within the school.